everyone, and thank you for the introduction. Hepatitis delta virus can cause severe liver disease, leading to the development of cirrhosis and an increased risk of progression to hepatocellular carcinoma. It is estimated that around 12 million people are infected with HDV worldwide, raising the global relevance of HDV infection. However, there's still a huge uncertainty about the real prevalence of HDV infection, mostly due to suboptimal screening programs. EASL clinical practice guidelines on hepatitis delta virus suggest that anti-delta antibodies should be tested in all HBsAg positive individuals, and HDV RNA quantification should be performed in all anti-delta positive ones with a real-time PCR standardized assay in order to diagnose an active viral replication. So the aims of this study were to investigate the rates of HDV screening and the factors correlated with the lack of screening among HBsAg positive people referred to tertiary centers across Europe, and to estimate the HDV seroprevalence and the rate of HDV RNA positivity among anti-delta positive individuals, and to depict the characteristics of individuals with an active HDV infection in the different European areas. These are the centers involved in the study belonging to the network ESAR, which is the European Society for Translational Antiviral Research, that we organized in 4 geographic areas: in light blue, Southern Europe; in green, Northwestern Europe; in orange, Eastern Europe; and in pink, Middle East. In this retrospective study, we collected data from 15,200 HBsAg positive people attending 16 tertiary centers during a window time of 3 years, from 2021 to 2023. And this study includes 3 national reference centers for infectious diseases, 2 national reference centers for viral hepatitis, 5 institutes of virology and microbiology, and 6 university hospitals collaborating with infectious diseases and hepatology units. These are the parameters collected for the study and that were organized in an ad hoc designed anonymized database. The main information was HDV screening, anti-delta positivity, HDV RNA testing, serum HDV RNA and HBV DNA, and ALT levels. And for those for whom data were available, we also collected this additional information in order to have a more complete picture. This slide shows the diagnostic tests that were used among the different centers. On the left, the serological tests used for anti-delta antibodies detection, and on the right, the HDV RNA quantification assays. And it is evident the wide variety of assays that were used among the different centers. Moving to the results, this table shows the characteristics of the people included in the study. They were predominantly male with a median age of 49 years, mainly HBeAg negative, and only 26% received the NUC treatment. The overall rate of HDV screening was 57.9%, and the rate of HDV screening varied widely across regions, ranging from 79.1% in Southern Europe to 71.5% in Middle East, 59.3% in Northwestern Europe to 23.9% in Eastern Europe, remarking that there are still areas with suboptimal screening. In particular, in Eastern Europe, despite the endemicity of the infection, there's still a limited rate of patients that are screened for HDV. And this is mostly due to the fact that in Eastern Europe, there's still a risk factor-based approach, and HDV screening is mainly performed in individuals with higher levels of serum HBsAg and ALT, lower levels of HBV DNA, and a more advanced fibrosis stage. And also HIV infection can be a factor driving for HDV screening in Eastern Europe, while we haven't observed this correlation between risk factors and HDV screening in the other geographic areas. So overall, HDV seroprevalence was 5.9%, with the highest rate of anti-delta positivity in Eastern Europe, as we expected, followed by Middle East, Northwestern Europe, and Southern Europe. Compared to individuals with HBV monoinfection, anti-delta positive individuals are characterized by higher levels of serum HBsAg and ALT, lower levels of HBV DNA with a median of 200 versus 1,000, and a more advanced end-stage liver disease as showed by the fibrosis stage higher than 4 and the percentage of people with hepatocellular carcinoma. And also here, HIV co-infection is more common in anti-delta positive individuals. Among 523 individuals with anti-delta positivity, 82.6% were tested for HDV RNA, highlighting that there's still not a complete screening for HDV. And the rate of HDV RNA testing varies among the different geographic areas, ranging from 97.6% in Middle East to 49.4% in Southern Europe. Actually, the low percentage of HDV RNA testing in Southern Europe is explained considering that one of the centers included in this geographic area does not have the in-house assay to quantify HDV RNA. The overall rate of HDV RNA positivity was 46.9%, with a median HDV RNA of 5.5 log international units per ml, and large variations were noted in both HDV RNA detection and HDV RNA levels among the different geographic areas, probably due to the different assays that were used. Focusing on the characteristics of the individuals with an active HDV RNA replication, they are predominantly from Europe rather than from Middle East and Africa, and they are characterized by lower levels of HBV DNA and altered levels of ALT. And HIV infection is more common in individuals with, that are positive to HDV RNA. Remarkably, there's a fraction of individuals that, despite the negativity to anti-delta antibodies, were tested for HDV RNA, and among those, a total of 7 from Eastern Europe, Middle East, Southern Europe, and Africa had also detectable HDV RNA with a median of 5.4. And this is in line with recent studies showing how some people, despite the negativity to anti-delta antibodies, have an active viral replication. And this is probably due to different viral subgenotypes that can elicit sets of antibodies that are not detected through commercial assays. So in conclusion, despite the substantial burden of HDV infection, there are still significant gaps in HDV screening across Europe, and in particular in specific areas. And notably, we observed a small but appreciable fraction of individuals that were tested for HDV RNA despite the negativity to anti-delta antibodies, underscoring the need for a greater standardization of HDV diagnostics. And so overall, this study supports a huge need to improve and harmonize HDV diagnosis measures and promote the access to antiviral treatment at pan-European level. And we're now at the second phase of the study, aiming at implementing the double reflex testing strategy in clinical practice. We have almost completed the distribution of the kits for anti-delta and HDV RNA detection. And for this part, this perspective part, it's important to collect data on HDV diagnostics for time window 2024-2025. So thank you for the attention, and I'd like to thank all the centers included in the study for their precious collaboration, and ISAR, and all the group from my university, Tor Vergata.
Thank you.